I guess I'll start with the first time I experienced fibroid pain, like severe fibroid pain, not just typical menstrual cycle pain, but the fibroid pain. I think it was last year, a couple months after my 31st birthday, and I made an appointment with my doctor, and she said, well, the only way to know for sure is to go up and see. So I went through a pelvic exam, and she determined that my pain was from fibroids. But that pain was not just cramping, but it was like severe, debilitating pain that could not be relieved with Tylenol or Advil or any type of pain meds or over-the-counter pain meds. And that was the very first time I felt the pain. The second time I experienced the pain, the fibroid pain, I was working, I believe it was a Tuesday a couple of months ago, and I was in so much pain. Tylenol wasn't working, Advil wasn't working, and it was really, really bad. I was in the office and I just wanted to lay down because the pain was so bad. So what I did was I got underneath my cube. Maybe about 5 minutes, and there was no one in the office because there was something going on, so nobody was there. But after a few minutes of being under there, I just realized I better go home. So on the train ride home, I was in so much pain. First I just wanted to lay down. The next thing I wanted to do, I just wanted to take off my pants because they were too tight around my stomach. So I was on the train and I just unbuttoned my pants. I was in so much pain, I didn't care. I was in so much pain and I was stretched out like this. My goodness. And that's when I realized that actually that was the first time I won't say ever, but in a very, very, very long time, had to leave work because of sickness or pain or anything like that. So at that point I realized, okay, I better do something about this. And my cousin gave me the phone number and webinar information for something she heard about called Uterine Artery Embolization. So I attended the webinar, and there were women from all over the US on the call, and the doctor was presenting to us what uterine artery embolization was and how it's used to help relieve fibroid pain. And it sounded interesting, so I just started researching it and got more information about the procedure and about fibroids in general. And I had no idea that a lot of women suffer through fibroids, and it's about 50% of women, and for African American women, some stats say that it's almost 75% of women. So between 50 and 75% of women suffer with uterine fibroids. I got more information. I contacted the doctor's office. It's the Fibroid Treatment Center in LA. And I got more information about the procedure, and I read over their FAQs. They sent me their case studies, and I read over those. And so I decided to go ahead and do the embolization. So the first step was for me to get an updated ultrasound, because I had an ultrasound from last year when I first experienced the pain, because they wanted to see if the fibroids were the same, if I had more. I got a second pelvic ultrasound, which was not comfortable to say the least. but I had to do it, so I got the pelvic ultrasound.
So this is the uterus.
That white thing on the screen, is that the fibroid?
Yeah, this here.
Oh, that. What's the white thing next to it?
Like this area?
Yeah.
That's just like connective tissue and things
Oh,
like that.
okay.
I got the pelvic ultrasound and the transvaginal ultrasound. I got that done, and the doctor looked over the results, and I made an appointment. I got the insurance all worked out and figured out what my portion of the bill would be. And so after that was all worked out, they were actually really nice. They set up everything for me, the pre-op appointments, the surgery time and date. Because I'm in Northern California and they are in Southern California, they worked out a good time and place for me. The post-op appointment as well, they worked all that out before I got there. So I didn't have to spend a lot of time away from work or a lot of time down south. So during my pre-op appointment, I was instructed to go ahead and get my prescriptions filled, the prescriptions that I would need for after the procedure, which was Percocet, Motrin, some medication for nausea, and some antibacterial medication. So I got those filled. The day of the surgery, they told me to be there at 5:30 a.m. I got there around 5:20, but they weren't quite open. They didn't open up until 5:45. I guess they just wanted people to get there on time. So I was waiting in the ER. They called me over and of course gave me a gown to put on and gave me these stockings, compression stockings that are supposed to be anti-embolism stockings to keep you from getting blood clots. So I put those on. Oh, and I forgot to mention the Miralax. They also wanted me to have some stool softener before the procedure, so I took that the night before, and also no eating after midnight prior to the surgery. So they gave me the compression stockings, and I put those on. They're really, 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 they're really, really, they're really, really, really super duper tight. But if they help, they help. I don't want blood clots, so I did them.
Your lovely stockings.
And you're supposed to wear them for 7 days after the surgery. So when I got there, I put them on. They shaved me down. They put me on a gurney. And I think the worst part, the part that I was most afraid of, because I had never been admitted to a hospital or been sick enough to stay or gone through anything like this before, so I was really afraid of the IV. And so when it was time for the IV, I just started bawling. I got really, really scared when it was time to put in the IV. And I can actually still see the hole that's there. There's like a little scab, I think. So it still hurts too. It still hurts. So that was the worst part. I think that was the worst part. I just started bawling because I was so scared, and the nurse said, "Listen, your mom is about to come back here. You have to stop crying." You have to stop crying. So I wiped my tears away, and my mom came back, and I had the surgical hat on, and I was all prepped and ready for when the doctor got there. And so they rolled me back, and the anesthesiologist said, "I'm gonna make you a little cocktail. You may hear us talking and you may hear us passing things back and forth, but don't worry. That's totally natural." But once she gave me that cocktail, I didn't feel a thing. I didn't hear a thing. I was out, and I really hope I wasn't snoring. But I was out, and when I woke up, I wasn't in the room that I stayed in, but there were people over me asking me how much pain I was in. And for some reason, I kept saying I was at a level 2. And even though I was in a lot of pain, I wasn't at a 2. Even though I was in a lot of pain, it wasn't a 10, but it definitely wasn't a 2. But for some reason, I just had it in my head that I was a 2. But then my mom said, Nina, are you sure? Look at the chart. And then I saw that a 2 was like a partially smiling face, and I was like, oh no, I'm not at a 2, I'm at a 6. So they gave me some pain meds, but unfortunately the pain meds were really strong, and that made me sick. So I was vomiting throughout most of my time at the hospital. So once they realized that it was the pain meds that made me sick and not just coming out of anesthesia, they switched it to morphine, 4 milligrams of morphine. And apparently what they were giving me before was 8 times stronger than morphine. And it was just, I think that was probably the second part. So the IV was the first worst part, and just being sick from the pain meds was the second worst part. But once they gave me the correct pain meds, it was okay. Then all I had to deal with was the cramping from the embolization and the fibroids dying. So that was fine. There were a couple of scares. My red blood count levels had dropped from pre-surgery was a 12, and then post-surgery was a 7 something. So they were concerned about that, so they kept taking blood. I think at least 3 or 4 times they kept taking blood, and my arm is still a little sore from where they kept taking blood. And this arm, not so. They took blood from both arms. This arm isn't sore, but this one definitely is. So the third time they took blood, they retested my red blood counts, and it was up to 11. So that fire was put out. The next thing was, I think there was an issue with my blood pressure being low, but I can't remember because I think I was still a little groggy when all that was going on, but it turned out to be fine as well. They took the catheter out around 6 o'clock, and they said, well, if you don't go to the restroom by midnight, we won't be able to release you in the morning. So between 6 and the hours after, I was trying to go to the restroom to no avail. And then when they came in around midnight, I said, okay, let me just try one more time. And I went in there, and finally, I was so excited. I've never been so excited to go to the restroom. So finally, and a couple of hours after the procedure, the pre-op clearance doctor came back in to examine me, and she said she felt a difference right away. It feels that my stomach, pelvic area feels a little bit softer, but other than that, I don't see a difference yet. But maybe once I get a little bit more comfortable, I will see more of a difference. The next morning, the nurses and the doctors had to do their rounds again and make sure all of my vitals were okay. And they released me with the pain meds. They also told me to walk 20 minutes every day. I walked around the hospital the night before. and I just felt very, very tired afterwards. I was in a little bit of pain. I would say on a scale from 0 to 10, my pain level was between 4 and 5, but the Motrin helped. I got a prescription for Percocet, but I only used it once. I didn't really need it. I also didn't need the medicine they gave me for nausea. I don't know if I just tricked myself into not feeling sick because it wasn't an oral medication, it was a suppository, and I really did not want to do that. And once they gave me, actually when they gave me that prescription, I was like, is there any other way that I can take it? And they said, yes, but we don't want your body to have to go through that. And this is the fastest way to not make you feel that way. So so I really didn't want to do it. So thankfully I didn't need it outside of the hospital when I got sick from the strong pain meds. But once I got home, I didn't feel sick at all, so I didn't even use it. Like I said, I didn't use the Percocet, just one pill, and I used it at night, so I guess it made me drowsy. I was going to sleep anyway, so I don't know. But the Motrin and the antibacterial medicine I use, of course. So once I reached home, I was just really, really tired, and maybe it was because of the anemia. The doctor did say that I was still anemic. She said she could tell by looking at my hands that they weren't pink enough. So she said that I should continue taking iron supplements for a year, and that should, I guess, build my levels back up. But I was just tired, and I just wanted to sleep. I would take pain meds and sleep, and then I would get up and feel a little better, eat a little bit, but I just slept mostly. Didn't really watch TV or read or anything. I just slept. And so that was Wednesday when I was released. I slept the rest of Wednesday night. Thursday pretty much the same thing. Thursday pretty much the same thing, but then I had the post-op appointment where I went back into the Fibroid treatment center, and they removed the gauze and took a look at the incision, which is actually just a tiny hole, like the size of a needle. I'm guessing it will probably be like my biopsy hole, which is really tiny. So they took off the gauze. They didn't cut me open or anything like that. And they just inspected that, checked my temperature, and just made sure everything was okay. And then they replaced the gauze with 2 bandages, and that was Thursday. They also instructed me to take some magnesium citrate. So I did that, and that actually helps a lot, along with the stool softener that I was taking before the procedure. They sent me home and have a follow-up appointment in 2 months to see how everything is going. But overall, I think it was a good experience. I think I did experience the leg and butt cramping that they said might happen, and I feel that when I am doing my 20-minute walks mainly. But now I know to take the Motrin before I walk to not feel the leg pain and butt pain. Actually, I thought it was my hip, but after reading over the post-op instructions again, it was probably my butt, leg area. So recovery time seems to be quite fast. The procedure was on Tuesday. Today is Sunday, and I'm going to work tomorrow. The reason why I chose embolization over the first choice, which is hysterectomy, because it's a very invasive surgery, and I think I am still relatively young, so that wasn't an option for me. And myomectomy, the reason why I didn't choose a myomectomy is because of the chances of them growing back. So I didn't want to have to get a second myomectomy after a few years, especially if I haven't had kids in a few years and they grow back. I would need it all over again, especially with the size that mine were. So I didn't want to go down that route. So overall, it's been a good experience. Only time will tell, of course. But for right now, I'm excited to not have pain anymore, not have the fibroid pain. I'm excited to not have heavy bleeding. I'm excited to not need iron supplements 3 times a day because of the anemia. So feel free to share this information, share my experience with embolization with any women that you know that have fibroids or are trying to make a decision about which option to choose, hysterectomy, myomectomy, or embolization.